Conscious.Enterprises. I'm Roxana, and I'm the founder of Conscious.Enterprises. Today's conversation is with Dr. Robin Berzin, who is the founder and CEO of Parsley Health. Parsley Health is becoming a major disruptor in the healthcare industry. They are a rapidly growing medical practice that is utilizing functional medicine without the restrictions of health insurance. And they are on a mission to improve health and well-being in the most forward-thinking and holistic way. The woman driving this movement is a true trailblazer. Dr. Robin is a graduate of Columbia Med School. She went to UPenn for undergrad, and she's also worked with Dr. Oz and Dr. Mark Hyman. Dr. Robin is such a refreshing and practical and mindful approach to medicine. She's committed to an ever-evolving standard of problem solving, and I personally believe that she is creating the next revolutionary wave of a superior care, cutting-edge testing, and just better overall health for all of her patients and her members at Parsley Health. I'm sure it's apparent how excited and passionate I am about the work that Dr. Robin is doing. So please enjoy this conversation. It's very impactful, and you'll hear about how she explains her passion for the mind-body connection, how that fuels her, how she's integrated these fundamentals into her innovative and metrics-proven business model, and just kind of the new way of thinking about healthcare and how we should be thinking about it. So please enjoy, please subscribe, and please follow us on social media. We're on Instagram, we're on LinkedIn, and we're on Facebook. And of course, check out our website at www.conscious.enterprises. Thanks so much. So, Dr. Robin Berzin,
hello.
Thank you so much for taking some time out of your super busy schedule to be here with me and being a part of Conscious.Enterprises.
Thank you for having me.
Of course. You are the founder and CEO of Parsley Health.
Yeah.
Columbia Med School, UPenn, but you're also yoga certified and to be a meditation instructor as well, which I love. And you're super entrepreneurial, so we've got a lot here to talk about. First, let's talk about what made you want to become a doctor.
Oh, it was actually my yoga practice. After college, I wasn't pre-med in college at all. I went back at Penn. Although when I look back, I did have some interest in public health and nutrition during college, but it wasn't my thing at all. And after undergrad, I was working in New York. I was not loving my job. I was working as a paralegal at the United States Attorney's Office,
wow.
so it was a very cool job, but it was not for me. And I had never really known anything about yoga, to be honest with you, growing up or in college or anything, but I started practicing yoga, and I just got really interested in the connection between the mind and the body. That drove an interest in health and wellness. I got interested in nutrition. And this whole interest area snowballed, and I was unhappy with my job at the time, and I sort of said, all right, well, what do I not like about my job? Okay, it's punitive, I sit at a desk all day, I don't feel like it is an important job, but I'm not helping the world. And what do I love? I love yoga, I love nutrition, I'm really interested in this mind-body connection, I'm thinking back to all of the public health studies that I did in undergrad, and all of that kind of coalesced to say, all right, well, let me switch jobs, and I worked at NYU for a year in the psych research department, and I wasn't interested in psychiatry as a field per se, but what I was interested in was experiencing patient care.
Okay.
And so that job for a year really gave me that. We did EKGs, and we learned to draw blood, and we had patients, and I said, okay, I've experienced this now, and I thought, do I want to get a PhD or an MD? Do I want to do something else with this? Do I want to be a yoga instructor? And while I did go on to do my yoga teacher training and teach yoga, for me, it just came together, and I said, I really want to get my MD and be a doctor because I really like this patient care thing. And if I'm going to have the best foundation in that I can possibly have, I should get my MD.
Very cool. I love that was your connection from yoga. That's amazing. And you're also super entrepreneurial. I read that you co-founded an app and did some work in the tech space. What was that experience like?
Yeah, so during med school at Columbia, a lot of my classmates were like me. We had other jobs and were a little older and a little weird, and I spent a lot of undergrad trading back and forth startup ideas with one friend of mine. I had worked for Dr. Oz as the producer for his radio show, so I had a media experience. I had worked for Oprah while working for Mehmet, and it was around the time that Facebook was coming out, and if we can even remember a time before Facebook.
I know, right?
It was a time that these social media tools were coming out, and technology was really changing the way that we communicated, and that hadn't yet translated into medicine. And so fast forward sort of towards the end of medical school, all of these startup ideas that we had coalesced in this idea, why can't we have an app for doctors that lets us communicate in groups securely and seamlessly in the hospital instead of waiting for landlines and pagers and fax machines, which is how people even today still communicate in the hospital.
Right.
And so it was kind of, it seems sort of basic now, but it was very, very revolutionary at the time.
Yeah.
And we built the app and started the company. And so that was my first, foray into building a company. It was my first foray into building technology for healthcare.
Amazing.
But I really got bitten by that bug. And so that's remained an interest of mine.
So was that before or after med school?
That was during med school. And at the end of med school, at the
Okay.
beginning of my residency. Yeah.
That makes so much sense.
Yeah.
Okay, how cool. So let's talk about Parsley Health. Let's start with, what is functional medicine?
So it's interesting. Parsley Health is bringing together the best of primary care, the best of cutting edge, what we think of as conventional Western medicine, and blending it with an approach called functional medicine or functional health.
Okay.
And so not a lot of people have heard of functional medicine or functional health, but ironically it's been around for a while and there's a lot of doctors practicing it. So functional medicine basically to me just means smart medicine. It says, instead of band-aiding the symptom with a drug or a procedure, let's try to fix the root cause. And by fixing the root cause of disease, not only can we deal with whatever you got going on now, but we can help you from down the road. It also says the body is an interconnected matrix. It's an interconnected ecosystem. Everything, our organs, in conventional medicine, we've sort of separated things out. Cardiology's over here, and neurology's over there, and GI's over there, and psychiatry's over there. And unfortunately, that's not reality.
Right.
Our organ systems are all interconnected. Our minds and our bodies are interconnected. And then we are an ecosystem, we now know, with our microbiome, our environment, our relationships, right? Our foods. And so functional medicine says, instead of just looking at a very small, narrow view of the body in one organ system at a time, let's look at the whole body as an interconnected matrix or ecosystem. And so to me, that really resonated. When I learned about it, back when I worked for Dr. Oz, I met Dr. Hyman, and I learned about the Center for Functional Medicine, or the Institute rather for Functional Medicine, which is training thousands of doctors in how to practice medicine this way. And then later on, I learned about the Cleveland Clinic Center for Functional Medicine, where the Cleveland Clinic, which is the top hospital in the country, has invested tens of millions of dollars in a functional medicine center and is showing incredible results. And so I was sort of learning about all this and watching this happen, and then also at the same time in my training at Columbia and Sinai, and I just said, okay, we need all of this, right? We don't need one or the other, we need all of this. But frankly, the functional approach, it just makes sense. And it makes sense in today's world where 86% of our diseases are chronic and lifestyle driven. So we're living ourselves sick. We're not, for the most part, unless you walk out and get hit by a bus, or there are things that just show up out of nowhere, certainly, certain types of cancer, etc., certain infections. But for the most part, 86% of the time, our diseases are things we're living our way into. And yet our medicine from prior is not really organized in a way that best helps us thrive. And so, I don't know why, but I think it was my yoga training combined with my health tech startup life, and all of that came together, and media training, and I said, okay, there's got to be a way to bring all of these things together, this functional approach to health with best of conventional medicine, with a content platform and a brand, and a technology layer, and how can we bring all those together? And that was Parsley Health.
Amazing. Awesome. Yeah, I love that functional medicine is also, you're always looking for the root cause as opposed to just like band-aiding things with prescriptions and things like that. And of course, once in a while you need a prescription, but you're really trying to make sure that that's kind of the last resort, right?
Exactly. And I think there's a lot of, bifurcation in medicine, right? There's sort of conventional medicine where it's like the only answer is a drug, and then there's integrative or Eastern medicine or holistic medicine, where a lot of times it's like drugs are evil and we'll do everything possible without a drug.
Right.
And we sort of say, well, both of those perspectives are a little silly. If the way that you're eating is the number one driver of your diabetes and your heart disease, why don't you change how you eat?
Right.
If you have a urinary tract infection, then let's give you an antibiotic and cure that, right?
Yes.
So it's really about what makes sense.
Right.
Yeah.
Love that. Great. And Parsley Health is a membership model, right? So give me an example of what people would value being a member at Parsley Health that they can't get through their like in-network insurance covered doctor.
Yeah, so there's so much that we do that a regular doctor doesn't. So first of all, our doctors in and of themselves are not only trained in conventional medicine, internal medicine, or family medicine, they're also trained in functional medicine, and then they also train with us. So your doctor, the moment you walk in the door, has a whole other layer of training of how to use specific nutrition protocols, lifestyle change, meditation, supplement protocols, and next generation testing that regular doctors don't do. Things like genomics, the microbiome, hormones, toxins. We do a lot of testing that regular doctors don't. So first of all, in your membership, you get access to a kind of doctor that has a completely different training on top of the regular training. Then from there, your membership includes all your visits with your doctor. So you get 5 doctor's visits. The average time is about 15 minutes. So the first visit is 75 minutes. Most people spend 15 minutes with their doctor, not an hour and 15 minutes ever, let alone just as their first visit. But that's just our first visit, where we do a really in-depth intake, we do a physical exam, we put a personalized plan together for you. Then, so you get all your visits with your doctor, there's no extra co-pays or anything for that. Then you also get a personal health coach. And a health coach, a lot of people aren't as familiar with, but health coaches have really proven their value. Research says that people who work with a health coach achieve their goals twice as often as people who don't. And so in addition with your membership, it includes no extra fee, visits with your health coach. And so your coach is there to help you make those changes. So if I, your doctor, recommend this, that, and the other thing, and you don't do any of it, well, you don't get better. And we don't see.
So they're kind of holding you accountable to the plan.
They're holding you accountable. They're making sure you understand it. Some people don't know how to cook in a certain way or how to eat a healthy way, or don't know what gluten is. Or, other people need help with how to take supplements. Other people need help with testing. It's like your personal assistant for being a Parsley member, because we want to make sure all of this is doable. Yeah. And if you meet with your coach and you're like, listen, Dr. Robin gave me 10 different things to do, and I really am not going to do them, but I can start with this one thing. Well, then your coach is going to help you start with that one thing. Right. And then on top of all of your visits, you also get so much more. So you get unlimited messaging, so you can write us a message any day, 365 days a year, and your doctor, we love that, lots of messaging. But your doctor or your health coach or one of our team members will get back to you. So there's always somebody there for you. You can write us with questions. You don't have to always have a visit to get a question answered, to get a refill, to get a test repeated. Yeah. You're a member, so anything you need in between, we're there. And then you also get a whole bunch of really cool perks and benefits. We have a lot of discounts and things with our partners, healthy food delivery, Thrive Market membership, free membership with Headspace and meditation app. Oh, cool. There's so many cool things that you get as a member here. And then on top of all of that, you get this crazy cool technology layer that we've built that lets you see all of your information, message, schedule online. So it's all really easy. Awesome. Yeah.
My next question is a little bit about your corporate culture, because you've expanded now. I know you have 3 locations, 2 on the West Coast, 1 here in New York, and you're expanding outwards and onwards. How have you been able to foster a corporate culture, and how do you hand select these doctors? Because like you said, not a lot of doctors know what functional medicine is, and some of them are practicing and don't know. How have you been able to foster that?
Yeah, so in terms of the doctors, I mean, we have hundreds of doctors now who've reached out to us who want to work with us, and hundreds and hundreds, maybe even 1,000 at this point, health coaches who've reached out. So, so many people are looking to do medicine in this more technology-driven, smarter, more whole person kind of way. That's so great. When we first started out, it was hard because we were so small, but now that we've grown a bit, we have a reputation and people are finding us, which is awesome. In terms of corporate culture, it's something that we're building every day. We have a set of team and company values that include things like we seek to live and work in flow, that include things like we are seekers and solvers. So we look for people who are really proactive, who are problem solvers, but who also want to live in balance and in flow. And, you know, we really look for that when we hire people. And then that's, you know, all brought to us by the amazing people we hire in terms of what we put into place. I mean, most medical practices or healthcare companies don't have annual team retreats upstate and internal cooking competitions and team lunches, and every single week we have speakers and experts come in and give talks to all of our doctors and coaches so that we can continue learning.
Awesome.
We have a weekly grand rounds with all of our physicians get together and talk about cases and learn. So we've just developed this really collaborative, supportive, team-based culture. You know, a lot of docs are out there kind of practicing medicine alone, and even if they're in some big institution, oftentimes they feel really alone.
Right.
And we're extremely collaborative and team-based, and that for me is what we're looking for. We're looking for folks who are, you know, they seek and solve problems, they're super proactive, they're here to be part of building something bigger than themselves. We want people who it's not about them, it's about us and the we.
Yeah.
But on top of that, then we want to create this atmosphere where they get a lot of support in reverse, and we support a lot of team building activities.
So, it totally does not feel like a doctor's when you're here. So it's definitely something that you're doing there.
It's very different.
This is kind of an easy one, but why do you consider your business a conscious enterprise, or what higher purpose are you serving here?
Oh my gosh. I mean, I'm lucky that I can honestly say that we help change people's lives every single day. I mean, that is our bread and butter is helping heal, nourish, educate, and transform and inspire. And that is really gratifying, and it's just awesome to have a company that's dedicated to doing that for as many people as possible.
That's amazing.
Yeah.
It's really, it must be so gratifying. What are some of the biggest problems that you see right now in healthcare? Like, what is like the one that you're just like, ooh, we're going to do something about that one?
Well, you know, a lot of the issues right now, I think, in my neck of the woods, and certainly there's lots of problems in healthcare and all over the place that, you know, I won't touch with a 10-foot but so there's somebody way smarter than me we'll deal with. But, you know, we've created a system that's really only responsive to large insurance companies. And so what that does is it means that you aren't paying directly, you're paying indirectly. You are paying for your healthcare, and it's very expensive, but you're paying indirectly for it, and so therefore it's not very responsive to you. It's not personalized, and it's really hard to innovate. Because if you think about it, if you have a group of doctors or a doctor who wants to do something differently, well, and they're dependent on insurance dollars, well, they can't, because if they do anything differently, they're literally immediately out of business.
Right.
And so that, to me, has kind of hijacked our industry. And that's unfortunate because it's kept technology from keeping pace in medicine, it's kept culture from keeping pace in medicine, it's kept new ways of thinking from keeping pace. You know, new information takes on average 17 years to work its way into general medical education.
Oh my God.
And so we have all these new understandings of the body that are frankly widely available, new tests, new understanding of the microbiome, new understanding of nutrition that are out there, and yet medicine kind of lurches along and is a bit stuck. And so why I'm so excited about Parsley being a direct-to-consumer service, we are responsive to you, right? Mm-hmm. And so we're able to actually iterate and innovate and build something that's designed around you that is here and now and of the future, right?
Yeah.
That is truly a consumer-driven service. And by building it this way, by putting it in our DNA, from the brand to the technology to the services we offer, that's not something you can undo.
Right.
And so from there, in the long run, while we may longer term, though not now, accept insurance directly, right now we help you get your out-of-network benefits back. But right now, we don't bill insurance directly because we don't want to be the kind of business that can't innovate because all of a sudden the old thing was what insurance paid for, and the new thing, which is 1,000 times better for you, we can't do because we can't get paid. And so that to me is where Parsley can have a huge impact, is in the way that the system is structured. Now, the other big area is that our unique approach to healthcare is truly unique. We're blending the best of conventional medicine and functional health, like I said. Our outcomes data is insane. We're literally curing autoimmune disease, curing heart disease, curing gastrointestinal disease, curing infertility by looking at the body in a different way.
Yeah.
And that, at scale, as we grow, will shift an entire industry simply because we already have the data to prove it, right?
Yeah.
So from the model to the medicine, I see a lot of people doing just the model, or I see a lot of people trying to make a medical service more technology forward, in terms of using apps and things. But at the end of the day, those things are just kind of window dressing if you're not doing medicine truly differently, and Parsley is the only medical service that I see doing it truly differently.
Right. Do you think that consumers or like patients, I guess, need to get out of the framework of thinking that you have to only go to places that are covered by your insurance? Do you think that that's going to start the wave, and then eventually, the health insurance carriers will kind of catch on that way?
Absolutely. I mean, if you only did to your car what insurance paid for, your car would be kind of out of business, right?
Right.
So unfortunately, insurance I think is essential and is important for prescription drug coverage, it's important for hospital coverage, it's important for labor and delivery, it's important for testing and laboratory testing, it's important for so many things. However, if you're only willing to go to things that is insurance covers, you have to understand that you'll be going to the lowest common denominator of the bare basics that they're willing to cover. And if you feel your health is worth more than that, you might have to spend a little bit extra out of pocket.
Yeah.
And a lot of people do it. It's funny, people will spend $5 a day on coffee, which equals $150 a month.
Right.
And yet they won't spend $150 a month for Parsley membership.
Right.
And you're like, well, what if you spend a little less on coffee or make coffee at home?
Right.
Or they will spend $40 a class on a fitness class that they do once a week.
Right.
And another $15 on a juice, which is spiking their blood sugar. And that altogether is more than a Parsley membership.
Yeah.
But they won't spend it on a highly credentialed doctor, health coach, and team to be their go-to anytime they need them for their health, right? And so I also think that we, as a consumer base, myself included, we've all been kind of schooled, right? We've been taught to think about medicine in a certain way. We only deal with it when it's an absolute disaster and we need it. We only do what insurance pays for.
Right.
We're not proactive. We don't have, direct skin in the game. And that's not true for everybody, but for a lot of people. And when you think about in the grand scheme of things how much money you can save by being proactive about your health, you're talking about $150 a month versus hundreds of thousands of dollars over your lifetime.
Right. Amazing. I think everyone should do it, personally. I mean, even just like one or two of those tests that are not covered by insurance, the things that you learn about your microbiome and things like that, you're not getting that at a conventional doctor.
Right.
Do you yourself have a regular ritual or practice? I mean, you're doing so much here every day. What keeps you aligned? What keeps you from losing it?
Oh my God, so many things. I mean, I do all the things. I mean, I eat incredibly well.
What's incredibly well for you? So
I eat a meat, what we prescribe at Parsley, which is our core eating plan, our plant-based paleo eating plan. So I'm eating proteins, greens, and healthy fats for every meal. I mainly eat a plant-based diet with a lot of healthy fish and occasionally some animal protein, but not a lot. So I'm getting a lot of fiber, I'm getting a lot of healthy fats, nuts and seeds, whole grains. I avoid foods that I'm allergic to, like dairy, which make me break out. So instead of spending, thousands of dollars on the dermatologist, I just don't eat dairy and then I don't break out. Which is the case for many people.
Yeah, it is.
Unfortunately, people don't realize that. They're, spending all this money on peels and creams when it's really just dairy.
Dairy, yeah.
So my diet is my foundation. I mean, I'm the sort of person where I won't eat processed horrible food.
Right.
Like, I just won't do it. I will skip that meal.
Right. When you do eat meat, do you make sure it's like grass-fed?
If I do eat meat,
that?
which, red meat, I don't eat chicken or poultry or pork, but I do eat grass-fed, hormone-free, sustainably and ethically raised red meat. I would say like once a month. And it's not that my diet has to be everybody's diet. I mean, at Parsley, we really personalize it. Some people do great in using intermittent fasting and ketogenic diets. Other people, that does not work for so well. And we have to do testing and make sure that you're okay on any particular nutrition plan. Some people have a lot of food sensitivities, others have none at all. So nutrition for me is the bedrock of everything. And then I have a really regular meditation practice. I have a regular yoga practice. Yoga is my love.
What style yoga do you do?
Oh my gosh, I went really into like vinyasa flow. Like I'm a mover. I like to move. I like to sweat. I like to twist. I like to attempt to stand on my hands, which I don't do very well. So yeah, for me, it's really I
meditation app.
Walk the walk. So I don't use, my husband uses Headspace every single day, and meditates with our son in the morning. As in, like, our son is 1, so he crawls around while meditation is happening. Nice. I have been meditating for a long time and have some other practices that I use. So I'm not a like app meditator. I'm more doing my own thing kind of at night. I'm also a night meditator. I like break all the supposed rules of meditation.
Oh, good. So you're a pro.
But that's something that I really find game changing. We actually prescribe meditation at Parsley Health.
Oh, that's awesome.
To almost every patient, we prescribe it more than medication. So
that's amazing.
Yeah.
And what are the findings that you found from that?
Oh my gosh. I mean, incredible results. We're helping people get off of antidepressants and anti-anxiety medications. We're helping people understand that their gut and their brain are very connected, and that you can actually resolve your reflux and your IBS and other things through learning to stimulate your parasympathetic nervous system through meditation. We see people understand that their brain and their bodies are intimately connected. We know that stress is the #1 trigger for an autoimmune disease. So if we help you learn how to do a regular stress reduction practice, then wow, how cool that you don't have as many autoimmune flares. Right. So again, the body's an ecosystem, it all ties together. So at Parsley, the brain and the body are always part of everybody's plan.
Very cool.
Yeah.
My next question is about success. How do you measure success? Do you consider Parsley Health to be successful today?
It's such an interesting question.
It's a timely question for you.
I know, it is timely. I measure success in a number of ways. Personally, I measure success, and then I measure it for the company, right? So the company, I measure success as in, are we living up to our mandate every single day to offer the most cutting edge, the most thoughtful, the most whole person and transformative medicine with the best user experience that we possibly can, both for patients and doctors, and I would say, and coaches and anyone else. And I would say, yes, we are successful. And so I try to take the attitude every day that we've already been successful. We've already transformed thousands of lives. And so if we just keep doing what we're doing, that is enough. And then, building out our new centers and building out the technology layer and hiring more team members and growing our membership and creating more online tools and programs, all of that stuff is gravy. Right. It doesn't mean that success doesn't look like those things too. Yeah. But I just try to have the attitude that we're already successful and now let's just keep making it better. Right. And so that's for the company. And then personally, I try to remember that none of this matters if I'm a wreck. And occasionally I'm stressed and I'm going to be a wreck because it's hard, right, to run a company and to start anything new, and I'm human and I get stressed. I'm a perfectionist, and if I weren't, I wouldn't be doing what I'm doing, so then I get even more stressed, right? But if doing this means that I'm miserable and can't be there for my friends and family, and my health falls apart, well, that's crazy, right? Yeah. So my goal, at least, and how I define success for myself, is that I'm calm, I'm energized, I'm free from illness, I feel good in my body, and I have great relationships across both professionally and personally. Right. And then I'm able to give my team my highest. And if work gets to be too much, then I need to know that I love this quote that I shared recently on Instagram, you don't need to quit, you just need to rest. Okay. And so it's a lot of building anything, I think, is a long game, and it's a long game of remembering the going will get tough, but when that happens, you don't need to quit, but sometimes you do need to rest. Right. And so that toggle of on and off is something I'm not certainly a master of at this point, but it's something I'm very aware of needing to constantly work on. Great. Like that. What are your goals, I'd say, for the next, let's call it 5 years for Parsley Health? Where are you? Where's Parsley 5 years from today? I mean, we are gearing up to really be everywhere. And when I say everywhere, I mean everywhere. So we'll continue to build out centers across the country, to begin with in cities where we already are, because there's a lot of room to grow in the cities where we currently exist. Yeah. Before we go further afield, but then in bringing Parsley centers and doctors and medical care other places. It looks like having incredibly robust set of outcomes data that is so powerful that insurance is beating down our door to pay for our care because of the outcomes that we've created. Right. It looks like having an online platform that literally, through our online tools that we're building, through machine learning and AI, through data, we're able to serve anyone anywhere and give them support in achieving their health. And we're building all that stuff out, whether it's through content, through programming, through smart technology, through telemedicine. I really want to be able to help anyone anywhere, even if they don't live near a Parsley Center, right? So that's where we're going. And in the meantime, again, we just try to keep doing what we're already doing every day, which is offering this incredibly new and superior form of medical care.
Very cool. How do you see the state of the world in healthcare in 5 years from today, and how do you see yourself and Parsley contributing to it?
Oh gosh, I don't know. Those are forces that are beyond my pay grade.
Is there like an epidemic you think that's like concerning you the most, or?
Well, we're breaking, have broken the healthcare system with this massive chronic disease burden that's totally preventable and often reversible. And we're spending all this money on like drug R&D for type 2 diabetes, which people could just not eat certain foods and not get. So to me, that's just crazy. And there's financial imperatives certainly that have nothing to do with us that drive that. But I hope that we are able at Parsley to set a new standard of care and to be part of shifting the healthcare ecosystem to do things differently. And if we can do that, great.
I think you will. I think you are.
Thank you. I hope so.
Yeah. And the last question for you. What's a valuable piece of advice that you'd like to give to other entrepreneurs who are creating businesses that have some sort of conscious intention like you are?
I see a lot of businesses that I would call like a solution looking for a problem.
Okay.
And I get that people get excited about creating things, but I would just sit down with yourself and understand that if you're going to build something from the ground up, you have to believe in it and be passionate about it in every fiber of your being. You have to deeply understand that problem, whether it's your problem or somebody else's problem, and understand how to fix it and understand what's missing and understand how you uniquely are bringing something to the world that nobody else is that fixes it, right? And then execute on that, because anyone can have an idea, but putting that idea into motion and to get it anywhere requires incredible tenacity, incredible resilience. You have to get back up when things just do not work, when people do not do what you want them to do, when you don't have the money that you feel like you should have, when a zillion things, I was describing entrepreneurs waking up every day to 99 problems, and I fix 16 of them, and 32 are evergreen, and another 10 just take care of themselves if I just wait and don't do anything. And so there's just the learning of that, and if you're starting out, to get you through all of that, the tenacity requires, the resilience it requires, the problem solving it requires, you have to be passionate about it, you have to be driven, and you have to truly, I think, believe deeply that your solution is not looking for a problem, that there's a clear problem that it's solving, and that you're really passionate about solving that problem. Because at the end of the day, you have to sort of be more passionate about the problem that you're solving than the solution that you've built. Because the solution itself is going to constantly be changing.
Right.
And that's, to me, what gets me through when things are really stressful or really crazy, or, I'm constantly learning how to do things that I didn't know how to do yesterday, and yet I have to do them today.
Yeah.
And that is a great learning experience, but it's also, I'm anchored by my passion for the problem, if that makes sense.
Yeah, it makes total sense. I think that's great. Thank you so much. This is really awesome.
Oh my gosh,
and
thank
I really
you so much for
appreciate your
having me.
time. This is so
awesome.
great.
Thank you.